Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm your host, Rob Hoyle, and today our special guest is Dr. Mark Jarrett. He's the Chief Quality Officer and Deputy Chief Medical Officer for Northwell Health. We're here, we're talking, we're not wearing masks. When we're recording this podcast right now, this is the first day that New York State said we can ditch the masks. Is it too soon?
There are some questions whether the CDC has acted a little too quickly. We're comfortable in here today not wearing masks because we're still socially distanced. We know that the ventilation in this room, because it's in a facility of Northwell, is adequate. And all three of us in this room are vaccinated. So it does meet the criteria. However, there are still some concerns about opening up too soon. Not that most people will be safe, but there can be some potential problems at this point, especially because not everybody has been vaccinated.
Right. But if you are vaccinated, you've gone through the vaccinations, it's past your 2 weeks since your last shot, or if you got the 2 shots, or if you got the Johnson & Johnson, whatever it is, you should feel relatively safe.
I think you should feel relatively safe. But it's not complete safety. And that's what people have to realize. And that's why people have to make personal decisions about where they will wear a mask and where they may not wear a mask. Clearly, if they're in with their family or friends that they know are vaccinated, they can feel comfortable not wearing a mask. However, we don't know who in the public has been vaccinated and who has not. And therefore, when you're in public settings, especially if you're older or have medical conditions that put you at a higher risk, you may decide to still continue to wear a mask. I believe a lot of people will continue to wear masks. I live in Manhattan, and last night, walking my dog, almost everybody was wearing their mask. And it wasn't because the governor said it, can't start till today. I think people are still, especially in areas that are hard hit like New York, are a little uncomfortable. And I think masks are going to be with us for a while.
Yeah, I think that the guidelines say now, too, that we can go mask-free, but when we're in areas like when we're on mass transportation, right, or we're in hospitals, we should still wear the masks.
Yes, hospitals still need to follow the tighter rules. Any healthcare facility, this includes nursing homes, other facilities. And the reason why is that we cannot afford people who are already high risk to perhaps be exposed to somebody. So we all need to protect each other, and in healthcare facilities still maintain that higher level of wearing masks.
Did this new update surprise you? And what is the reaction for you and your colleagues in the medical field?
So the new update from the CDC was surprising. Nobody expected it to come out, quite frankly. Obviously, some people knew about it, but most of us didn't. There has been some controversy in the medical field. There are some very prominent people who say this is about time. It's good to do. It's very low risk, and I don't disagree on their scientific basis. On the other hand, there are other people, very prominent, who say this may have been a little premature. That, if we'd gone a little longer, we might have been able to get to the same point and not risk having another flare-up of the disease such that we have to lock things down again, which would really be psychologically very damaging to everybody in the country. So I'm sure it was a difficult decision for the CDC. I don't think they made it willy-nilly. I think they used scientific evidence the best they could. And what it comes down to is a judgment call, which much of medicine often is. It's a judgment call. And only time will tell us whether, and hopefully we'll be lucky and it will be the right judgment call. But I think we have to keep our eye on the ball. We have to monitor the numbers, patterns, the variants that are here in our communities so that we can quickly not have to maybe go to lockdown, but certainly maybe pull back a little bit if it's necessary. Europe's had to do that a couple of times already. They opened up, last summer, everything, and then they had to clamp down again completely. United States, we've been just kind of following a curve going down in terms of lockdown, doing slowly taking things away and very rarely having to redo that. So we will have to see whether that will be necessary again with further new rules, or are we hopefully on that downward decline for getting, having the disease disappear and therefore continuing to open up things. the most important thing is for the public not to vilify people wearing masks. There's a lot of media. Why is this one wearing a mask? Why is this one not wearing a mask? On both sides of the fence. And I think that this is a public health issue that people just should make personal decisions, and people should not hold it against them if they decide they want to wear a mask.
Yeah. And one of the things too, when we talk about wearing a mask, we know masks are effective, and we know that they're super effective just in the fact that it stopped a lot of other things from happening. Like flu season this year was basically non-existent. And I think we can credit that for people wearing masks.
Well, it's a combination of the fact that people wore masks, that they didn't get the flu, and also people didn't congregate together. Basically, people were locked in their homes, or, were not doing large crowds. So the flu really didn't spread. I think a lot of people took the flu vaccine this year also because they were afraid of having the flu and COVID. So it was a combination effect. However, I think we need to learn from this in a public health way, that during the flu season, it may be worth, in large areas, being on mass transit, riding the subway, maybe people put on a mask, even if they've had a flu vaccine. Flu vaccines at best are 50 or 60% effective. And in addition, we were, in bad flu years, we can have 60,000 people die from the flu. That's not an insignificant number. And therefore, probably we may need to rethink how we do things in the future. That would probably wane over the years, but at least for the next several years, that may prove to be an effective way of preventing the spread of many common infectious diseases.
Right. And I think what you said is, so true. Like, we shouldn't judge people, and we shouldn't, it became a little politicized, the mask and everything else, but we shouldn't judge people because we don't know what people are going through. We don't know if somebody on the train is wearing a mask because maybe they're having some treatment, or maybe they have a cold and they don't want to, they're just being courteous to their fellow riders, that they don't want to pass on their common cold to somebody.
And again, if they are a little bit higher risk, if a vaccine is 95% effective, it means 5% still can get sick. Maybe they won't get very sick. Maybe, they're not going to die, but they're still going to get sick. And we don't know what the long-term effects of COVID are. There's a lot of literature now that shows even in younger people, COVID has had some impact on their lives, which is well persisting for months after they got the disease. There may be fatigue. Some people complain about brain fog, other things. And we're evaluating how much impact this really had. But it's a new virus. We don't know. If we go back to the polio days, many people who were adults in their 50s and 60s about 20 years ago who had polio when they were young developed something called post-polio syndrome, where they actually got weakness of muscles because their nerves, the nerve cells, were damaged by polio, but didn't show up for 40 or 50 years. We don't know what the impact of this virus is long-term. So therefore, it's probably best to try and not get it and use vaccines to give you your protection.
Yeah. No, so I think one of the big questions too that people have is that, like, if they're vaccinated, right? So if somebody who's vaccinated and they come in contact with somebody who has COVID, can they then pass COVID to somebody else and never feel any effects of it?
We really don't know the ability to transmit if you've been vaccinated. Certainly in people who are perhaps immunocompromised might more easily, like a transplant patient, colonize the virus and be able to spread it. We don't think it spreads that easily. I think the big concern is if you're vaccinated, but you're that small percentage where the vaccine is not fully effective, coming in contact with somebody might get you sick. And again, you want to avoid that if you can. And once we achieve that issue of herd immunity, which is really kind of critical, then the virus doesn't spread around so much that it becomes very unlikely even that 5% will ever get the disease. The reason that measles vaccine works, it's not 100% effective. It's because if everybody takes the measles shot, the virus just doesn't live in the community. And even if you're in that small percentage that didn't respond well to the shot, you're not going to get sick from the measles. It's the same thing with COVID. And that's why getting the whole general population vaccinated is critical. The other thing is that there are these variants, and if everybody's protected, it's unlikely these variants can really grow up, so to speak, or spread in the United States or in any other country. And if we can therefore get everybody vaccinated, which is really the key, then this disease will slowly disappear over the next couple of years.
Yeah. Do you think these new guidelines will kind of put more pressure on people who are kind of, that have that hesitancy to go out and get the vaccine?
I unfortunately do not believe that that's what occur. I think it will do the opposite, and that's my main concern about the sudden, unexpected loosening of the rules. We do not have vaccine passports. They're going to be done by private companies, maybe by states. Empire State Pass is a very good thing. You can download the app if you've been immunized in New York and prove that you got immunized. But now this is basically saying anybody who's not been vaccinated